Dr. Won, it's great to be with you.
It's great to be with you too. Thanks for having me.
Yeah, so before we get into some of the more biotech talk and your device, I wanted to actually start with your background and hear a little bit about your experience in the military as a flight surgeon and maybe how that shaped your mission now.
Oh, sure. Yeah, so I was a flight surgeon with HMM 268. Was a Marine Corps squadron, and we were attached to the 11th Marine Expeditionary Unit, Special Operations Capable, and frequently referred to a MUSOC. And we deployed to the Persian Gulf and had a successful deployment, but ended up going back after 9/11. And as a byproduct of that, we had some of the first casualties of the Second Gulf War, and had a lot of friends involved with that. And so the preceding 10 to 12 years, we were trying everything we could to help the guys and gals that were involved, and tried meditation therapy, cognitive behavioral therapy, medication management, and I think all the things were effective, but we ended up running, a few people were still struggling. And so we're always on the lookout for something that would be helpful. And concurrent in my career, I finished up my medical training at a couple of the Harvard hospitals, and ended up back out on the West Coast, first with the Boeing company as one of their chief physicians. And I took on a secondary role as their chief technology officer for medical services, which is how I sort of interface with this technology. And, in medicine, you sort of get used to more incremental changes, but we were seeing some pretty significant improvements in patients who are struggling with conditions like post-traumatic stress and depression. And so it caught my attention and was something of great interest. And eventually I ended up joining the company around 2015, 2016, and have been on board ever since, and trying also to wrap around, I think, the innovation, a lot of robust academic science in clinical trials. So yeah, that's how I ended up here.
Yeah, well, it's a fascinating journey. I want to go back to that initial, basically, I think you said there was something when there was a deployment, and then this led to several deaths in your squadron. Am I understanding that correctly? And some
Yeah.
PTSD resulting from the violence.
Yeah, well, it was a night mission, and one of our aircraft, and the mishap report is still, I think, hotly debated among our pilots and air crew. But they were in the middle of a sandstorm, and there's what's believed to be a vertigo episode, and the aircraft went nose down, and all of the pilots and air crew and passengers perished. And it was, of course, I think, very dispiriting as a group. And that's I think part of the struggle, just trying to help everyone out from that. And you're never quite the same, but the brotherhood that you have with these guys, I still consider that whole group some of my closest friends, and would do just about anything for them. And so even after I left the service, it was doing everything I could, whether it's referrals to different VA doctors, or getting them resources to see private counselors, turning them on to transcendental meditation. We're doing everything we could to help them out. And so, that's ultimately kind of that search is what led us to this. And so it's all sort of part of the journey, I suppose. But yeah, it's funny sometimes these occurrences change your total life trajectory in ways that you don't anticipate. And that bond, I think, with my friends, there's a certain commitment that never leaves. And I think all of us are frequently looking for, um, a purpose-driven life or a mission, and this one really resonated with me in a unique way. And so, that struggle of, at that time, I was uh, in a great role at a Fortune 50 company and was really enjoying my work. And to leave and join a startup, that's always kind of a daunting decision. Um, but when paired against the opportunity to help so many people, that became an easier decision in the long run. So.
Yeah, and so I'm fascinated by so PTSD is obviously a big issue, but especially in America, it seems. I was reading, I think it was like 30% of veterans at some point experience symptoms of PTSD, and but you look at a country like Israel and it's only 1%. Um, like, why do you think there is such a prevalent issue, especially in the U.S.?
Yeah, it's a great question. And, I should preface this by saying I don't think I have all the answers. But, you know, Israel's been in conflict, I think, for just pretty much its whole existence. And I think that's sort of indoctrinated into the culture. And we went through a relatively lengthy period without kind of major conflict. And then we've had a very sustained conflict here. And so I think that's part of it. And then reintegrating back into, non-military life is another part of it. But I sort of have grown to have a different view of PTSD. Is it's not necessarily, I don't perceive to be a gross abnormality, or I think there's a faction that believes disorder is the wrong name, and there's, General Corelli has promoted that we should be calling it post-traumatic stress. This is a normal reaction to a highly intense and stressful environment. And, I believe there's a lot of truth in that. Where I think it starts to become more challenging is when it starts to impair your activities of daily living, and in some cases can be profoundly paralyzing, and in some cases disabling. And so that's, I think, the vulnerable population that we strive to help. And yeah, it's a great question that's come up. I don't think it's a uniquely American phenomenon, particularly as it relates to veterans. And the other piece that I think frequently gets lost, I wasn't aware of this until I really became immersed in the work of the company, but the largest population of post-traumatic stress is actually survivors of sexual trauma. And so that's one of the areas where you think about groups that we could help, or vulnerable populations where we can impact. It's just a huge group, and you think particularly in today's environment, whether it's COVID-19 first responders, paramedics. Um, I think there's a growing list of individuals who struggle at different levels, and depending on what their coping mechanisms are, it can become more of an issue than it has to be, so to speak.
Yeah, well, and that's an interesting point. I hadn't even thought about PTSD goes beyond the military, but with regards to the military, it was really, it first came on, or I became aware of it to the extent of it through a book called Tribe by Sebastian Junger. Are you familiar with that one?
Yeah, of course.
Yeah, so it's just incredible book, and he really talks about how the military creates such a bond, and it's the kind of tribal crew that we used to have in our small scale kind of hunter gatherer societies for many thousands of years as we were evolving and as our brains were evolving. And that's kind of what we crave, and those are the relationships we crave. But then you take someone who's been in that tight knit community and you throw them back into a society that can be very isolating, and he thinks that's one, he postulates that's one of the reasons that PTSD can be so intense, especially in American society or a lot of Western societies where it's a little more isolating.
Yeah, I think there's a lot of truth in that, and I think those kind of discussions are really important, really just as part of the healing process as well. Um, there's something about the crucible of combat that forges bonds that really um, stand the test of time, so to speak. And that brotherhood, when you leave, I think it's sometimes hard to anticipate how much you're going to miss. There's sort of a built-in social element, whether it's at the squadron level or the battalion level. Every day that I went into work, I was surrounded by, 150 of my best friends, and we would all do. Literally, you put your life on the line for each other, and when you leave, I don't mind sharing. When I left military service and went to an academic setting, um, gosh, you really miss those friendships. And, you call and you talk, but it's not quite the same. And so I think um, part of this is that loss of brotherhood. And you don't want to bother your friends who are still in active duty. And so now that many of us are retired, we're still can kind of bust on each other and talk, and those friendships last. But in the immediate time when you've left service, I think there is a bit of a struggle. And, I certainly felt it for myself, and um, that potential for isolation. And there's, I think, this magic window of time when people can leave the service and have a very smooth transition. And that transition management, I think, is becoming much more of an area of focus for both nonprofits, but also for people who are in service, and those who are part of that migration out of service. So,
Right. Absolutely. Absolutely. Well, listen, I want to also talk about the device that you've created to help deal with this problem on a more kind of a immediate level, which is the I think the best place to start would be just defining what is magnetic e-resonance therapy, because it was something that I'd heard of for the first time when I came across Wave Neuroscience in your device.
yeah, it's and so this is the base technology is something called transcranial magnetic stimulation, and it's been FDA approved since about 2009 for treatment-resistant depression. And we'll take a bit of a dive into that technology, but our specialty is personalizing treatment to the individual and empowering physicians, I think, to customize treatment to each of their patients. And so we do that through really a three-step process. And the first step is to get what's called an EEG, an electroencephalogram. And that's functionally an electrophysiologic brain map, showing kind of how the different areas of the brain are communicating with each other, and identifying areas through a normative database that may not be functioning as well as they could. And so, just as an example, most of us are encoding information at a certain alpha frequency during our wakeful hours, and that will usually be somewhere between the range of 8 to 13 hertz. And you might be a 12.4 hertz brain, and I might be a 9.2 hertz brain. It tends to be sort of where we live, and it'll vary a little bit throughout the day, but there tends to be a dominant wavelength that we operate at. And what we found in getting now tens of thousands of EEGs is we can see areas that may fall out of synchrony with that dominant wavelength. And just as an example, the stereotypical waveform pattern for depression would be left dorsolateral prefrontal cortex, sort of the left frontal area of the brain cycling too slow, let's just say at 2 hertz. So if there's a spot in the front of your brain that's cycling at 2 hertz, and the rest of your brain is cycling at 12 hertz, that information mismatch may manifest as a certain constellation of symptoms. And in this case, an individual may feel lethargic and not wanting to get out of bed and lack motivation. So the geographic location of the abnormality informs us a bit of how an individual may be experiencing the world. And in a separate scenario, let's say the visual cortex, there's a blast injury and somebody falls back and strikes their head. You may be cycling, let's just say at 30 hertz. And if they're oversampling their environment 30 times per second, but only able to process 12 times per second, that information overload may cause somebody to experience anxiety. And so we're able to take these images and extrapolate some very useful information. And what's been interesting for me is even without the treatment, just visualizing that there's a functional abnormality allows, I think, a lot of the healing process to start. Because I think individuals realize that, gosh, I'm not just a jerk. There's a reason for me to feel this way. And if it's just the circuitry of my brain is off just a little bit and it's manifesting as these symptoms, how can I work to improve that? And just to be totally transparent about it, it doesn't have to be our technology. There are many things people can do to improve their cognitive function, whether it's meditation, whether it's proper nutrition, whether it's getting better sleep. All of these things I think are important to allowing people along their healing journey. What we're adding to that is using this transcranial magnetic stimulation device and geo-navigating to the area of the brain that may not be operating as well as it could, and providing stimulation to either speed up the neurons or slow down the neurons to their optimal frequency. And when we find improved coherence of the different areas of the brain, many times, not all the time, but many times, the symptoms will ameliorate, and people can then, importantly, I think, start endorsing more constructive behaviors for themselves. And so uh, I think as time has gone on, we've learned to be smarter about how we deploy different technologies. And I think there's great truth and wisdom that it really takes a village. And we've gotten unsolicited feedback from many talk therapists and counselors that getting this treatment has enabled an individual to be more open to healthy dialogue. Marriage counselors, whatever's happening, let's keep doing it, because they can now listen and not, move to rage so quickly. And so I think that's important for us in serving this population well, that we wrap around them all those other types of modalities, whether it's marriage counseling, grief counseling, meditation is something that's available to everyone. And in particular, I think these foundational elements of getting good quality of sleep, protecting your sleep, making sure the type of nutrients you're putting in your body are high quality nutrients, getting the right exercise, all those things are critical to us, helping the people in the manner that would be best suitable for our patient population.
That's fascinating. Well, I like how you just describe this as another tool in the toolkit, as opposed to like, a quick fix or something. It's one of many tools, and this is the first time that I've heard that your brain networks or areas of the brain will fire out of sync because of some kind of disorder. So do we know why that happens?
Yeah, and so there's a lot of different potential reasons, and when we think about sort of medical pathology, it can be a mechanical injury like a car accident, or being too close to a blast. Just the sound, that blast wave can cause certain types of injury. Um, Years of hard drugs can certainly cause oscillatory dysfunction in the brain. Um, Emotional trauma is a very common reason for people to kind of fall off their optimal pathway. One of the more common, and I think people sometimes don't think about it, but profound sleep deprivation, and especially in our culture where we're just so driven and we'll sleep deprive ourselves. Matthew Walker famously has said we're the only species that will voluntarily deprive itself of sleep for really no good reason or no benefit. And I'm guilty of that just as much as anyone. But we do find very commonly that there's a strong correlation between people who are getting very poor quality of sleep and some kind of emotional distress. So yeah, I think the answer is there's many different types of both environmental and mechanical types of insults that can cause injuries to the brain. Interestingly, there's a doctor out of the facility called Enter Health in Dallas. Hal Urshley wrote a New York Times best-selling book called Healing the Addicted Brain, who we've sort of been walking these parallel paths where he has viewed chemical injury to the brain to be really the equivalent of a traumatic brain injury. And I think one of the exciting parts of being in this space um, is that the knowledge base is evolving so quickly. And, the arc of science tends to follow certain unifying patterns. And we're starting to see across disciplines that these different methodologies all kind of align in a unique way. So yeah, and I mentioned earlier that article you wrote about self-directed neuroplasticity. Um, I would say that's been one of the most useful tools, I think, to our patient population is, using meditation to augment all the other things that people are doing.
Just for those listening, because when I first heard about it, it was almost scary sounding. Like I think I was picturing electroconvulsive therapy, like what would go on in the 30s where people were getting shocked. But this is just, and I think I see one behind you over your left shoulder. It's just a piece of headgear, right? It's non-invasive, and it's just using a magnetic field to change the frequency at which the neurons are firing. Am I understanding that correctly?
Yeah, well, also the device up here, that's called a Zeto. It's a type of EEG. It's a dry lead EEG.
Okay.
And so this is sort of the first step in our process. The stimulation devices, there's a variety of different ones. So we're using transcranial magnetic stimulation, which is a powerful magnetic coil. It's about 1.5 to 2 Tesla. And there's a wand that goes over different areas of the brain and provides gentle pulses. So it's not anywhere near the amount of energy being delivered by electroconvulsive therapy. It's kind of a very large amount of wattage and voltage that's being delivered to the brain. TMS is a much kinder, gentler form of stimulation. And the reason magnets are being used, it kind of threw me off at first. Anytime I hear magnet, I immediately get very skeptical. But what I've learned over time in talking to specialists in the area, neurosurgeons and neurologists have shared that the first order principles of physics of that coil being able to deliver energy across a solid barrier, that's why magnets are being used. And so we, as humans, we have a 1 centimeter thick skull that uncovers our brain, and to be able to stimulate the cerebral cortex, we have to deliver energy across that object. And so that's why there's a transcranial magnetic stimulator being deployed. What you may be thinking of, we've also innovated kind of a wearable TMS device. It's a home device called a Nest, and we're still kind of in the beta stages of producing that and deploying that, but we're using permanent magnets at a much lower threshold of energy than what's being used by TMS, and orders of magnitude less than ECT. And so just for the benefit of your audience, ECT it's a very high energy type. You need anesthesia to get it, whereas TMS is a much gentler form. It's described, some people have said it's like a hummingbird tapping your forehead. Some people have called it a brain massage, but you don't need any attendant anesthesia. It's effortless. You sit in a chair for 20 to 30 minutes, and there's some pulses that you feel. It's about 6 seconds every minute for 30 minutes, depending on what protocol you're getting. There's some that can be a bit shorter. And then this next generation, the Nest that I was talking about, we sort of asked the question, many times in medicine, what's the minimum effective dose to achieve a clinical effect? And so as we titrated down the energy delivery, we found that the amount of energy that was required to get a benefit was actually quite low. And so that's what we're trying to bring to market, is a device that is very safe with good efficacy, but more for a performance wellness approach rather than a truly medical device.
Got it. So the consumer device is not for official treatment and the therapy that you were talking about. This is a more kind of drawn out process where someone first gets an EEG and an EKG and then goes in and gets the magnet treatment. Okay.
Yeah, that's right. And so kind of the medical grade technology, these are all FDA cleared devices.
Mhm.
What's been interesting, and if you could hear me, I'll share this story that, as a physician, our mission is about saving lives and stamping out disease. And this is sort of, our calling. And as this technology started becoming better known, we started doing clinical trials with academic institutions like the USC Center for Neurorestoration, and we're now starting up a project with the Texas A&M Institute for Bioscience and Technology, and it's a growing list. But we had a visit to U.S. Special Operations Command, and there was a two-star general who asked the question, I love what you're doing for the guys, but is there a way to improve performance, or what he called prehabilitation? And that struck a chord with me because simultaneously, many of our other facilities, there were executives and elite athletes who were asking for, can we tune up our function? And so, yeah, you always have to listen to the market. And so we realized there was this kind of emerging group of human performance specialists who are kind of wanting to hack our health and neuroscience, and see what we can do to improve what would by most standards be considered a very healthy individual. And so while it wasn't something we embarked on deliberately, we started exploring, what can we do? And we have observed some kind of exciting changes. And that's where there's sort of this pivot to, we have a medical technology. What could we potentially do from a consumer-based wellness perspective? So,
That's cool. So I want to make sure I'm understanding how this works. So the magnetic field that's coming from this coil is basically changing the frequency at which the neurons are firing. Why are the neurons responding to the magnetic field?
yeah, so that's a great question. And so this is what we call neuromodulation. You're actually modulating brain activity. And there's different ways to do that. And what I've come around to understanding, and so you can do laboratory studies, and they're what called single patch clamp studies, where you can take a piece of neuronal tissue, whether it's an animal-based neuron, or there's some neurosurgery procedures that require, for example, if somebody has intractable epilepsy, some of that neuronal tissue can be used for studies. And they found that when you deliver these kind of energy pulses, the activity of that neuron can change or modulate over time. And that is what eventually led to this innovation of transcranial magnetic stimulation. And separately, there's a neurosurgical procedure called deep brain stimulation. And they found that you can make these small changes in the electrical architecture of the brain with very small doses of energy. And whether it's lowering kind of motor potential thresholds, or entraining brain activity, I think there's still a lot of academic debate about the exact mechanisms. But what we've observed over time is that many times the brain or a group of neurons may just get stuck at a wrong frequency. And if you just give it a gentle nudge, the body does a lot of the work for you. And so an example I would give you is somebody may come in for a week of treatment, and normally we would want 4 to 6 weeks. And they may come back after a month, and we can see in that month, after just a gentle nudge to this group of neurons, it does a lot of the work for you, and they come back with a much better frequency. Their brain health looks quite a bit better than it was, weeks earlier. And so, and this kind of aligns with these principles that nature's kind of designed us to be a healing organism, whether it's, you put 2 ends of a wound margin together and that wound will heal, or you put 2 ends of a broken bone together and that will heal. Sometimes you just need the right environment and setting for the healing to take place. And yeah, our role, in terms of this technology, is just to give a friendly nudge to a group of neurons and allow them to resynchronize with the surrounding neuron groups. And philosophically, I think that's what we're aiming to do. We're not trying to overpower the brain with too much energy. ECT is kind of a hard reboot, just a lot of voltage. I think what TMS is striving to do is just to give a friendly reminder to neurons to work at a certain frequency.
So you mentioned earlier that you were skeptical of this technology at first. What made you come to the realization that, hey, this stuff's legit?
Yeah, it's great. And it's funny to think back now. It was about a 2-year journey for me. I met the team here, a group of doctors and engineers and scientists, and they opened my eyes a bit to the potential of neuromodulation to help many of these conditions. But it was ultimately one of my friends from the Marine Corps that I sent in as a test case. And he himself was very skeptical, but was willing to give it a try. And he had a fairly profound change in a short amount of time. And when I saw him, we lost touch for about 10 years. And really a group of friends had reached out to me and said, hey, can you talk to our buddy? I'm going to leave his name out. And we spoke, and I talked to his VA doctors, and he was a faithful Marine and tried everything that the doctors gave to him, but wasn't feeling significant improvement. And so he agreed to come in, and really within 2 weeks, there's a fairly profound change. And it was to the point where if I didn't know him, I may not have believed that it was possible. But another kind of validator for me was that his wife came into the clinic, hugging the technicians and the people at the clinic, saying, "You gave me my husband back. This is the guy I married 10 years ago."
Wow.
And so those kind of things are very, I think, moving, and kind of remind us the spirit of why we go into this profession. And so over time, we watched him not just improve kind of from an emotional resilience perspective, but he also was able to come off a lot of his drugs. And so that for me was, I think, the spark that, maybe there's something more here. And the scientist in me wanted a bit more validation. So I sent in a second Marine and a third Marine, and I was hearing similar stories. So you start to wonder, is this generalizable? Is this reproducible data? And so we've tried to follow this on with more robust academic rigor. And we've got the beginnings of a lot of those studies. And I think we're probably just on the front end of a mountain of academic research that needs to be done. But I think what's exciting is we're starting to better understand, I think, how a lot of these pieces fit together, how they work, and how we can kind of come up with a coherent treatment protocol to help people along their paths.
Now, it must be hard to control for placebo when you've got like a lot going, an extensive process. So is that something you are able to control for in these clinical studies?
Yeah, so we always do our best, and the placebo response has been quite profound actually in many studies, and has many times worked against, I think, we haven't seen as much separation from placebo as we would like. And there's many hypotheses about this, whether it's just the regimented routine of coming into the same setting every day, whether seeing a smiling face at the other end of the coil providing the stimulation. And there's many hypotheses, but what we found is even in our placebo coil, if we put a Gauss meter next to it, we have found that there's an amount of stimulation that's delivered to the subject. And there was a paper just published within the last few months that found it's actually enough energy to produce a clinical response. And so the placebo may have been much stronger than we anticipated. And so, there's sort of two sides to that. I think that it is the gold standard of clinical research and science, and we always have to have a placebo and a control group. But the other side is if people are having very significant responses to placebo, and that may not necessarily be the worst thing in the world, that there's a benefit to it. And so to answer your question, I think you've hit on a very important point in terms of being scientifically honest. We haven't always gotten a huge delta from the placebo. But now I think we're illuminating that what we thought was placebo actually may not have been placebo at all. And that's been something that's really sort of been a conundrum for the industry. Is we've seen these massive placebo effects, sometimes 20 to 30% reductions in symptoms. And
Wow.
so, yeah, and so that has been a challenge for sure.
I mean, yeah, so I'm a firm believer that obviously the placebo is important in figuring out the mechanism, and there's a reason it's in place, but at the same time, if you're getting a 30% reduction, that's a great therapy, even if it is just the ritual and having someone touch your head, or whatever it is about that environment. But it'd be interesting to understand more about, like, what is it specifically that's causing such a big placebo effect, because that could help with other therapies, I'm sure.
Yeah. And so I think the whole industry is working towards that end. And so we're interested in trials where there's kind of a true control group, somebody who, whatever the condition or disorder is that's being studied, they're getting no treatment, not even a sham coil, and sort of assessing what the change is over time. But, um, but yeah, these are, I think, it's not just us. This is kind of, I think, all of science struggles. The placebo
Mm.
effect is something that's very real, and I think is probably an underutilized therapeutic. I think just
Yeah.
believing that something is working um, i- is helpful. And
Yeah.
so, if you can achieve a clinical placebo effect, this it's not the worst thing in the world. But of course, you'd want something to be more clinically proven and tried and true, and
Yeah.
show that separation and signal in trials.
Well, it's so fascinating to me. I want to do a whole episode on the placebo because, and I've read this book, You Are the Placebo by Joe Dispenza. I don't know if you've read it. I mean, there's a lot of kind of pseudoscience mixed in, but his general point that we have this whole pharmacy in our brains and we just need it's almost like belief can activate that in some sense, or having, yeah, there's like this innate healing power to our bodies, but we need to be able to believe that we can heal ourselves in order to tap into our kind of pharmacy. Speaking of which, I wanted to hear your thoughts on other treatments like SSRIs and what you think of kind of the more pharmacological approaches to the issues that you're now treating in a very different way.
Yeah, it's always an evolving space, and so antidepressants and SSRIs, I think they're still considered first line treatment for depression, and they have their place. And so, um, yeah, yeah, I don't have. Um, I try not to be too much of on a soapbox and diminishing the value of SSRIs. I think they do have their place in the armamentarium, but I think more and more as we become informed about different non-pharmaceutical options, I think about what I would want for a loved one, whether it's one of my children or a best friend. Um, you know, whether it's meditation or EMDR or other types of non-pharmaceutical options, I would always sort of exhaust those options first. Um, One area that I think is interesting and rapidly evolving are some of these newer kind of microdosing, for example, psilocybin. It seems to have a very significant size effect, and I think there's a lot more research to do on it. But I would say that's a very promising area of research, and I think that in terms of the medical community, it certainly has not been mainstream, and we tend to be, as a community, very slow adopters. And so, as a class of pharmaceuticals, hallucinogenics, there's a bit of a stigma around it, and I think we have to get over that first. But to answer your question, I'm definitely not an anti-pharma person, but if there are ways to achieve benefit without them, I'd always encourage individuals to explore those before turning to medication management.
Right. Yeah. And I think, inherently skeptical based on my own previous use of, for me, it was a diagnosis of ADHD and subsequent use of Adderall, any kind of chemical dependency that gets formed. And much more gravitated towards therapies like yours, where it sounds like there's only, there's lasting changes, but it's more of a, you come in for a couple of treatment sessions. And same thing with, some of these psychedelics that are showing promise, like MDMA. I was reading there's a phase 2 study where the results came back that a bunch of PTSD patients who had on average had PTSD for 17 years, 56% of them had no symptoms of PTSD a year after taking just 2 MDMA, MDMA sessions. So that all that, it's very promising. I think the general direction that all this is headed in. What do you think the future will look like if everything works out and heads in the direction you want it to, with your device and with kind of all the modalities that are out there? What do you think that treatment might look like in the near future?
Oh, it's a great question. And, there's so much disruption, I think, in the industry right now. It's sort of hard to forecast where the industry is going to go. But I do think as time marches on, things will become, I guess, effective in a shorter amount of time. We're going to get smarter about dosing, even in, what some people would call the electroceutical industry, how we deliver those in a precision guided manner, and how we can make them more portable and consumer friendly and safer. I think all of those interests will hopefully be incorporated into the new technology. So one of the areas of interest right now, I was just talking to Mark George, who's really one of the thought leaders in the neuromodulation space. And, he was mentioning a lot of the research being done right now is on sort of closed loop systems where you're doing real-time imaging with treatment and refining based on the biological signals. And that to me is very exciting. I think we now have the processing speed to do that where we probably didn't even 10 years ago. And so I think it's really an exciting time to be in the space and innovating. And I think from a consumer perspective, you'll start to see a lot more of these technologies brought to market. And so that I think is probably where the industry is going. You saw some of the initial effort with the Halo device, the TDCS device came out maybe 5 or 6 years ago. And, there's other types of those devices that have proliferated the market. And so both on the medical industry side and I think on the human performance and wellness side, we're starting to see quite a bit of innovation coming to market.
Do you see changes if you take an EEG after someone has used your device that suddenly the brain is firing in sync? Have you done kind of before and afters like that?
Yeah. And so that's where I think this has really become very interesting. And that was one of the validating points for me. And for example, in the case that I sent in, it wasn't just that he was subjectively feeling better. We could actually track this on the EEG and see whether it's through what's called a fast Fourier transform, where you're trying to eliminate the time domain and look at the alpha oscillatory waves. You can see these changes even between sessions. And so we've spread it out by doing these EEGs by about every week to every 2 weeks, and we're looking for positive change. And so I think what's interesting is we're trying to identify, are there, for example, genetic biomarkers that may be predictive of somebody's going to be a responder or non-responder. And we don't know why some people don't respond and others do. We have some intuition, but I think we're getting smarter about those kind of things. So yeah, I think that there's, we're always trying to refine our knowledge base and how do we get better. But to answer your question, yeah, you can see these changes in real time, and that's the part that's exciting, and it sets up the next challenge of how do you make those changes more durable and long lasting.
So for folks who are interested in trying this out, where can they learn more or sign up, or what does the process look like for actually undergoing the therapy?
Yeah, so we sort of have two separate entities. We have a technology company called Wave Neuro, so it'd be waveneuro.com. Um, and then we have, there's something called the corporate practice of medicine, where if you're using technology, you have to be totally separate. And so there are doctors and clinics who are utilizing the technology, and you can find those at braintreatmentcenter.com. And so if you wanted to learn more kind of about the base technology, you can visit Wave Neuro. And if you want to look at where to visit one of our centers, braintreatmentcenter.com would be, I think that they have a list of the different clinics that you can go and visit.
And these are in different states throughout the U.S.?
Yeah, different states in the U.S., and then we have facilities in Australia as well.
Oh, nice.
Yeah.
Right on. I'm sure all the Aussies listening will be pumped about that. Um, right on. Well, listen, it's been great to speak with you, and really appreciate all your knowledge on this important topic.
Yeah, really a pleasure. Thank you so much for your time.